reason, because when we moved into the family practice center in 511, I brought my practice in there. That's what I did, you know. All at once, August 1, I was no longer out in Mogador. I just had my practice. My patients came with me, brought the staff, and then here comes Dave off. Let's go see patients, Dave. I guess that's what you do in a residency. Well, that's what I knew. I knew how to go see patients in the hospital and take care of them. Wasn't that good at teaching outpatient stuff yet. But things changed, didn't they? Because that's where our specialty is. But I was well prepared from an inpatient basis. You know, I was a great inpatient doctor. The first floor where we were, half of it, there was a pool table over there, and that's where the residents came and played pool. Well, we were supposed to be seeing patients. Well, the residents are doing what residents do when they want to go over and relax, what have you. Well, I didn't like that. So this guy's named Harold Farmer. Oh, Ed, you know we don't have money, and da-da-da-da. Fine, goodbye. Another letter of resignation, you know. So we got the first floor all ourselves, you know. We got it. Now there's who's on the second floor and the third floor? You know, residents are coming over and sleeping. And during the day, and they're making noise, and I got to walk through our hallway and walk through it. Well, Mr. Funk, and there was a guy named Mr. Kelly, you know, what have you, trying to explain to them it was difficult. Well, you know, I was real patient. After about 20 minutes of explanation, out whips the next letter of resignation. A very immature thing to do, and I think you had one of them the last time, didn't you? You had one of those letters of resignation. But I learned about those challenges, and although my response was immature, when I then went to the University of North Carolina, I really learned about tough negotiation. You know what I had to do when I first got there, and I had to negotiate this beforehand. I learned clearly something I didn't do well when I took my first job here was get everything in writing before you go. But those quote super specialists had screwed the department and taken $50,000 away from them just for the honor of, you know, we'll teach your residents, gets 50 grand. So I had to negotiate with the dean and take 50 grand. So here's the chairman of medicine, who's got a CV about 250 pages long, multiple researcher, and I'm sitting down talking to him, and the first thing he says, well, you took my money away, now what do you want? So I learned that. I think that's been tremendous. And I think the reason I'm bringing that up, we're still having challenges with our colleagues in the other specialties. We're still having challenges. So I think what you learn, and sometimes I was accused of being a fighter, but sometimes, you know, I think we have to be political and we have to be smart, but sometimes you just say, enough is enough. I'm no longer going to put up with your bullying and your crap. And we're getting plenty of it now. We're getting plenty of it now. Don't be afraid, because what we want is right. So I think these challenges help. Our challenge with managed care companies, our relationship with allied health providers. Who's going to do primary care in the future? It's got to be done by somebody else in addition to physicians. I'd say let's partner with them. Let's partner with the nurses, the nurse practitioners, the PAs. Granted, we have a different and more of an education, but there's a place for them. But we got to learn to negotiate with them too. But they can be tough. They can be tough. Do that. And in addition to all those challenges, what does it come down to the most? And what I've been doing the last 7 years has been the most fun. Because I've taught residents, I've taught students. I get to teach faculty because I do a lot of CME education. But what's been fun is to go to physicians' offices. And I'm doing this thing called our Diabetes Master Clinician Program. What I do is work with them. We put all their diabetic patients in this register we've developed through the Florida Academy of Family Physicians. We have about 95 offices in Florida. The rest of them are other multiple sites. I just came back from Memphis, Tennessee, and was working with the University of Tennessee there and helping them. But what I'm learning is probably the most important thing. And if I share something about the future, where it's all going to be, we have got to learn how to empower our office staff. As simple as that may seem, I think that's one of the critical things that's missing. Team. And you guys are doing it. You're talking about team. Team. It's just so critical. The medical home requires that. If you want to have a medical home, somebody asks what it is, start first with saying you've got to have a team that addresses things. You have got to take and delegate to your staff. Push them to the limit of their licensure. It doesn't take an MD or a DO degree to do some of the things that you do. Why should you be the one that orders a urine microalbumin? There should be a clear indication, clear policy. That's what you do yearly on your patients, and it gets done. What you want to deal with is the result. Is the result. So I empower office staff, and then most important, I know you know this, I'll say this right now, and I'll say it again as I end. Who are the most important? Is our patients. They are our past, our present, and our future. Remember that. I just think it's the basis for everything we do. If everything we're doing, every time you want to think about money, I think that's secondary to what are we doing with our patients. And I know you got to make a living, and I know you in your office, you can't make a living without thinking about the funding. But if you do what's right for patients, and that's where, you know, what did the gentleman that climbed Mount Everest say? He said, how did you do it? He says, every morning I got up and I looked up there, I knew where I wanted to go. And I just kept pointing that way, one step at a time. So that's where we're going towards that patient, all right? So when I moved 40 years ago from Margador High to 511 East Market Street, I didn't know this would happen. You know, they say most things happen to you twice in your life. You know, it's you create them twice. First in your mind, and then in reality with the dream. I never imagined what I've just seen you guys do. You can't imagine something like that. I didn't know how it would work. I didn't know how it would work with Dave and as we create more residents. But you know what I found out is you get together with a bunch of good people. You keep the patient in mind, good things will happen. And I mean, that's what you guys are doing. Look at this wonderful stuff you guys are doing for internationally, what you're doing for research. You guys are doing it. So what, again, the future, and this may sound political, and it's all about politics anyways, isn't it? But I am not pushing any political party, although, is he a Democrat, by the way? I am too, so I'll say that. But every time you start talking about healthcare reform, everybody thinks it's political. You got to decide, is it this or is it that? And unfortunately, those things. But I think we've been bullied. I think we've been bullied. We've been bullied by specialists. We've been bullied by managed care. And I think we've got to speak out. We've got to speak out. You've probably heard, and congratulations on that position. That is a very significant position, and thank you for your service and willingness to do it.